Many problems you can't see and you can't know by yourself that you have them. So when you go to the dentist, the dentist can check up and see if you need some kind of small treatments instead of waiting for 20 years and then going, and you need to have a lot of big treatments.
Now, between us ladies, now let's say you are not a dentist. Dentists are not like car mechanics that you go for a routine checkup and then you go out with a bill and an engine check.
In most of the cases, if you can brush your teeth and you have a good hygiene and you go once a year to a dentist or even dental hygienist, you just clean a little bit of calculus or plaque or between the teeth, checks everything, and you go without any treatments at all. But if you don't go to the dentist or you have some kind of problems that are undiagnosed, then you need to treat them, because if you need to have a tooth filling, so you need to have it before it becomes a root filling or a root canal treatment or extraction and implants. So you need to know in what condition you are.
So once a year?
Once half a year. Your dentist will tell you when the next time you should come for him, because if you were not very good in the hygienical aspect of cleaning the teeth, it's a problem. So you need to come every 3 months, every half a year. If you have great hygiene, you can come once a year also.
From your experience, most people do it?
Of course not.
No?
No.
So you say
like you don't go to a car mechanic before you absolutely have to.
Something that we need to change how we think about it. The dentist is your friend.
Yeah.
The more you will visit the dentist, the risk that some sort of problem will evolve into something complex is less.
Absolutely. In places where you have to go to a checkup every 6 months or a year, you have less treatments. Most of the things that you do are checkups. When you don't go to the dentist, or you go to the dentist when you have some kind of pain or something like this, you have pain in one tooth, but all of the other teeth probably have some kind of problems also. So maybe you have pain in one tooth, but you have a lot of different holes or caries or problems with all the other teeth.
My dentist tells me to go for him something like half a year. What exactly does he, why? What does he do? What is the procedure?
First of all, your dentist will check if there are any problems with the soft tissues, not the teeth. Because if you're smoking, for example, you have a high risk for cancer. So the doctor checks if you have anything irregular on the gingiva, on the soft tissues. Then your dentist will make a couple of x-rays to see if you have any holes, any caries, any cavities in the teeth themselves. Then your doctor can tell you what you're doing right and what you're doing wrong in the process of the maintenance of the teeth. So if you're brushing your teeth very, very well or not, or you have any problems. If you have some big treatments, for example, like crowns or implants, the doctor can check the crowns, the integrity of the crowns. The doctor can check the implants. Sometimes you have some kind of inflammation because something was stuck, or you have residues of cement or different kind of things around the implants, around the crowns. So all of those things the doctor can see every time you go to him. The best result is, of course, the doctor says that everything is fine and you just go.
Thank you very much.
You're welcome.
And thank you for being with us today. Don't forget to like, share, subscribe, follow to stay tuned with the latest cases.